Hello, I'm Kelly. I'm the owner of Premier Family Care Clinic, and I just want to welcome you as a new patient and go over some important information that you need to know coming in as a new patient here at the clinic to make your transition into our clinic very easy and painless. So today, or on your new appointment, we do expect for you to bring in your driver's license or a copy of a state picture ID so that we can use that for identification. Also, a copy of your insurance card. You will get a text message or email prior to your appointment that will request these, and if you can snap a picture with your smartphone and send it in, that will save you some time in the office, and we'll also have a digital copy of that. You will get an email or a text requesting you to pre-register. If you complete this ahead of time, it will save you some time in the office. Want to go through our financial policy. Payment is expected at time of service, so if you are a cash paying patient and you do not have insurance, we do expect for you to have the full amount due the day of your service. And we do accept cash, check, and debit cards, credit cards. Insurance information, we will file your insurance company. You are expected to pay your copay as your contract for your insurance states. If you have two insurances or co-insurances, those do typically cover your copayment. And we will bill a secondary insurance if you have that available. You are expected to pay your deductible each year. So in January, those deductibles reset. So typically a deductible is due the beginning of the year. If that is the case, then the insurance company likely will defer some of their payment towards your deductible. And so you may get a statement in the mail saying that your first visit for the year has been transferred to deductible, and you will be responsible for that. If you have problems with payment, we do accept payment arrangements, and you can always call and ask to speak with our business manager, Chad Lambeth, and he can get that set up for you. Also, when you come in, especially later in the year, if you have any insurance changes, please let the front office staff know this in advance so that we can get the correct insurance information placed on your account so that there are no problems with billing in the future. We do accept Medicare. Medicare pays for 80% of the visit, and then the patient is responsible for 20% of their visit unless they have a secondary or a Medicare Advantage plan that will cover that additional cost. Non-covered services, sometimes your insurance will determine that something is not covered by their contract, and you will be responsible for those payments. Cash paying patients, just as I mentioned before, all of your visit is due up front. We do give you a discounted rate because of that reason. We have to take the full payment up front. The insurances that we have contracts with require this. We do offer procedures and injections that are not covered by insurance, and those are cash-based services such as our wellness injections, our IV hydration therapy. All of that is due up front prior to the actual procedure injection. We do not allow non-payment, but if you go into 90 days past non-payment, then we will have to unfortunately turn that over to a collection agency, and you may be subject to termination from the practice. Return check fees. If your checks are returned that you make payment with, there is a $25 charge for that, including whatever the visit was, the payment that you were making with that return check. Another very important policy that patients need to know up front is our missed appointments and late arrivals. If you do not give us at least a 24-hour notice for cancellation of your appointment, then you are charged a $25 no-show fee or late fee. We do not allow patients to be seen after 15 minutes from their original appointment time, just because that will put the provider behind, and it will also put the appointment times of the patients after you behind. And we try to stay on time. That's very important to the providers here. We always try to not keep our patients waiting. And then medical records will be processed if we get a medical record request, and they have sent over the proper signed release from you. Then we will release those to whoever's requesting a copy of your medical records. If we are requesting a copy of your medical records because you're coming in as a new patient and there's a fee from that practice that you're leaving from, then that fee will be transferred to you. If you have any questions regarding billing, you can always reach out to our business manager. The office number is 251-626-6757. We look forward to having you as a new patient. Also be aware that currently in Spanish Fort there is some road work, which do typically put you behind traveling to your appointment. So please allow for that, and allow for 10 to 15 minutes for you to find the office. It is difficult to get into our driveway currently because they do have the road in front of our office closed. So you have to go down and turn at the sports complex road that's just past our original entrance and come back up the road that they're actually working on currently. There are barricades up, but you are allowed to go around those barricades. Also, please allow 15 to 20 minutes if you are a new patient and you're coming in to fill out information to complete your documents and stuff on our iPad prior to your appointment, so that you will be ready once your appointment time comes available. Again, we welcome you to the practice, and if you have any further questions, please let us know.